Hello dear friends, welcome back to my show. The headlines are screaming that there's an oxygen shortage. And a shortage implies a mismatch between supply and demand. Is it due to an unwarranted overuse of oxygen that is driving the shortage? Let us explore and understand the situation better. I shall begin by first giving a warning. Overuse of oxygen can be harmful, and most people, including medical professionals, are often unaware of this fact. The demands of relatives can often force medical professionals to give supplemental oxygen to patients who are under their care, and that can have some very disastrous effects, besides causing shortages of medical oxygen. Now, a quick reminder of what oxygen is. Nobody will deny that oxygen is an essential element that sustains life. And without oxygen, humans can only survive for a few minutes. However, there should be a balance between the demand of the body for oxygen and the supply or the delivery. This is essential in order to maintain homeostasis or the natural balance of the body. The two main organs systems which are responsible for oxygen delivery in the body are the respiratory system, which consists of your breathing apparatus, starting with your nose and ending with the lungs. And the second system is the cardiovascular system, the heart and the circulatory system. Taking that into consideration, we'll be able to understand how this all functions. Now, when do we need supplemental oxygen? Supplemental oxygen is required in a condition known as hypoxia. And what exactly are the symptoms of hypoxia? The first telltale signal is that the skin, lips, nails, they turn blue or cherry red. It can also be accompanied with confusion and dizziness, as well as a fast heartbeat and shortness of breath. These are telltale signs of hypoxia which really need supplemental oxygen. Did you know that oxygen can also be very toxic? This is what a standard medical textbook has to say. Breathing oxygen at higher than normal partial pressures leads to hyperoxia and can cause oxygen toxicity or oxygen poisoning. So under what conditions does oxygen become toxic? Oxygen toxicity can happen in two conditions or scenarios. It can be acute or it can be chronic. It happens in an acute setting when high concentrations of oxygen are given to a person for a short duration of time. A chronic condition can evolve if lower concentrations are given for longer periods. As you can see in the diagram below, oxygen given appropriately helps in survival, which is a physiological process. A healthy physiology requires the correct amount of oxygen at the correct partial pressure in order to maintain a functioning physiology. But in case we exceed the partial pressure of oxygen administered, it develops what is known as a reactive oxygen species, which causes oxidative damage to cellular constituents. That means the damage goes right deep into the cells. Here is what another seminal paper from the University of Michigan has to say. This was published in the American Journal of Respiratory Critical Care Medicine in 2020. So once again, this is a post-COVID research paper. And what it tells us is that there is a tendency amongst medical professionals to allow above goal oxygen in critically ill patients. Also, it is quite common among critically ill patients receiving significant respiratory support. And this suggests that practitioners are permissive of this oxygen. So this has become a very common practice for whatever reason, that critically ill patients are often given permissively high amounts of oxygen which they really don't need. Here are the findings of the Medical University of Vienna. The reference is given below at the bottom of the slide. And what it says is that substantial hyperoxia burden was observed in ICU patients, and young patients with less comorbidities showed hyperoxic episodes more often. I'm sure you can put two and two together. Does this explain the deaths that are being seen across the country in younger patients, and that to those who are being administered supplemental oxygen? In case I missed telling you earlier, the term hyperoxia is a state when there is an excess supply of oxygen. Here is the guidance from Dr. Christopher Peter Nickson, a renowned medical teacher and a consultant intensivist at Melbourne, Australia. And I quote from his Critical Care Compendium, which is a standard guide for all medical practitioners. What he has to say is that traditionally many ICU patients have been exposed to hyperoxia through liberal oxygen supplementation practices. And this is likely due to lack of awareness of the potential harms of hyperoxia and failure to specify or to adhere to an upper limit of the target range. A very clear indication that this is one situation which can be easily avoided. Please take note of the underlined words. You can next refer to this paper, which was published in 2019 and is regarding the physiology of oxygen transport and its determinants in intensive care unit, a situation in which many COVID patients find themselves and where they are administered supplemental oxygen. And I quote from the paper which I referred. It says, the use of supplemental oxygen is so common that we forget that it is a drug. And every drug, of course, as we know, has side effects. Continuing further, the paper states that supplemental oxygen is vital for the treatment of hypoxia. However, routine use in the absence of hypoxia provides absolutely no benefit. In fact, it can be harmful. Finally, here is what a meta-analysis of improving oxygen therapy in acute illness has to suggest. It states that liberal oxygen therapy increases mortality, that means the rate of death, without improving any patient-centered outcome. Please note the underlined words. The paper quoted is given below. Here is a summary of the points discussed in the video. These are the facts that you must know. We must question ourselves, is the oxygen demand fueled by excessive and indiscriminate use of oxygen? In the first wave, there was a shortage of ventilators. They were being used in cases where really they were not required. So ventilators got a bad name. Now it is excessive use of oxygen. And we saw the various reasons. It could be out of sheer lack of knowledge or forgetting what they learned in medical school as medical professionals, or it could be the insistence of relatives of people. The general conception in the mind of an average person is that oxygen saves. Let us question ourselves, is this shortage of oxygen man-made? And I'm not talking about black marketing, I'm not talking about low rates of production and problems in transportation chains. The real fact actually lies in the overdemand created by overuse of oxygen, which is a big blind spot in our medical system. We also talked about the dangers of liberal supplemental oxygen, supported by various references that were quoted. So friends, that brings me to the end of this video. We shall meet once again in a later video. Until then, bye bye.